So, does what you eat impact your hormone levels? I'm Dr. Ted Naiman.
I'm Dr. Greg Naiman.
Welcome to What the Health.
That's a great question in terms of, again, how does what you eat actually impact your hormones? We get a ton of these kinds of questions around hormones and how does, again, I'm changing in terms of my age and how are my hormones being affected. What should I start thinking about? And we get people asking us about, well, what about the foods? And more than just that, it's really what they're looking at is not just their hormones. They're asking more about their signs or symptoms. I want to feel a certain way. I want to look a certain way. And how does my eating habits really impact those things? So, and we talk about, again, from a female health perspective, all around, Women's Health Month, we want to talk about, well, what does that look like? What is nutrition? How does nutrition actually impact their hormone balances? And then, of course, how they actually medically, physically, and from how they aesthetically look, how does that all impact?
So, I mean, it's a common thing that, again, it's, as you mentioned, where we'll have, female patients come in and say like, hey, are there certain things that I should avoid that might be causing problems with my cycle change? First and foremost, in those situations, I'll usually kind of go back and first, let's look at just like your weight pattern. Weight will have a lot to do with your cycles and or just hormonal levels and fluctuations. So if somebody who has like a rapid weight loss, a lot of times will start causing a shift in a bunch of their just internal hormones because of all the different changes that happen on a pituitary level. So it's not uncommon for us to have somebody who all of a sudden, and that's where a lot of there's over the years we understood and understand a lot of these myths that come along with like only somebody who's maybe is anorexic and has like a body mass index in the less than 5th percentile starts having issues with hormone period. We now understand even just a fluctuation of 5 or 10 pounds up or down can actually start to shift and shift your balance of your hormones as well. So rapid weight shifts one way or the other can start having a significant impact on your hormones.
Right.
Other things that like when you start talking about like other foods or things like that, a common question of like, a soy protein, black cohosh, or those kind of things.
Right.
And those certainly can have some estrogen-like effects. And oftentimes will be things that will be touted for like women who are maybe kind of going through that pre, peri, and postmenopausal phase, and they want to do things that are like more natural and not go on estrogen replacement therapies. Maybe we should mention some.
Absolutely. So again, I like that too. So we want to make sure that we're talking about it during, the earlier cycle phases where we see a lot of them, what they used to call the athlete's triad, where they would lose weight rapidly or they would start exercise programs and their shift in their body weight or stressors on them because they're now at a certain point in their lives where they're being stressed because of school or exercise. And you see that drop and then it causes those hormone changes. And it's not just what you're eating, but what you're not eating. And then that can cause changes in your menstrual cycle. With those individuals, we also see the next phase, which is going to be closer to the perimenopausal phase, like you were talking about. And now we're seeing women who are, it's going to start getting, the things that are going to get impacted are going to be things like vitamin D levels and those kind of hormones or prohormones that affect bone health and brain health, as well as skin and those kinds of things. And then we get into the postmenopausal phase. And those women, when they're in the postmenopausal phase, there's all kinds of different things that we have to start thinking about from a hormone perspective. And we see, again, hot flashes or flushes, again, some changes in terms of tenderness or dry atrophied and drying of like vaginal mucosa, things like that. Those kinds of things, then we start noticing women who are taking these supplements, black cohosh, soy, because they're trying to impact those. Typically, the amount that you'll have to take to really impact those things, unless it's just mild symptoms, are going to be so high that really you should be coming in, talking to your provider, and then getting on the prescription strength hormone replacements. So those are going to be your bioidentical, biosimilar hormone replacements to get you to that level. So that way you can feel good, look good, and medically be healthy.
Right. And help keep your bones strong, et cetera, and all those kind of things.
Right. And then, of course, at those different ages, you're going to have different testing that you're going to need. So that way you're coming in and making sure that, are we measuring the other things too, your thyroid hormones, beyond just the hormones that are talking about from estrogen and progesterone. But like you mentioned, it's going to be some of the pituitary brain hormones or, and some of these other ones that we want to measure as well.
Yeah. And one other thing to kind of contemplate and think about as well is going back to like, again, so rapid weight shifts, like going down can certainly cause fluxes and changes, but also going up in regards to like the more adipose tissue that we have. And this goes both for men and women. The more aromatization that we have, and what that's a fancy term for just saying that your body will actually make more estrogen. And that increased estrogen will start causing more issues. It might start causing irregular, heavier periods or more irregular periods and or more fluxes, maybe some breast changes as well because of some of these hormone fluxes that can happen. And that would happen actually from weight gain, not necessarily from weight loss. These are all things to kind of think about when you're talking about dietary and changes.
And in the industrial world, we see more weight gain than weight loss. Remember, 60% of the U.S. population now is either overweight, obese, or morbidly obese.
Right.
So we're seeing way more of that. And then the impact on hormones. And of course, when that impacts the hormones, it impacts other things like sleep. And then when you start impacting sleep, that impacts other things in terms of like your muscle strength and your ability to keep lean muscle mass, which then impacts hormones again. So it's a vicious cycle once it happens.
Right. So hopefully you guys have learned a lot from this session, and hopefully continue to listen for more discussion on these kind of topics.
Yeah, if you have any other questions about how to make hormones, we won't go into that. But again, so we want to make sure that, again, leave some questions or comments in below. And if you want to hear more about this topic, please let us know, and we'll videos on this.